welcome to The Acorn, the podcast that drops a little bit of psychoeducation so you can gain a better understanding of the therapy world and yourself. So without further ado, let's jump into our episode. Hello, and welcome to Season 1, Episode 14 of The Acorn. Today we're going to be talking about what is Cognitive Behavioural Therapy. CBT is an evidence-based therapeutic modality introduced by Aaron T. Beck. The idea with CBT is that our interpretation of a situation can influence our emotional, behavioral, and physiological reactions. In a nutshell, my unhelpful thoughts can then negatively impact my feelings about a person or situation, and then my feelings can impact how I behave. Since our thoughts, feelings, and actions are interconnected, it's helpful to identify and challenge any patterns of thinking that's increasing our feelings of anxiety, depression, or distress. It's helpful to notice any unhelpful thinking styles or thinking traps. Some examples of thinking traps are all or nothing thinking. That's where we believe things are either all good or all bad. Overgeneralizing, where we may come to a pretty broad conclusion based on a single event. Filtering out the positives, where we focus on just the negative aspects of things. Mind reading, where we believe we know what others are thinking. Fortune telling, where we think we can predict the future for certain. Emotional reasoning, where we believe our negative feelings are facts. Labeling, where we make global statements about ourselves and others based on one situation. And catastrophizing, where we predict that the worst possible outcome will definitely happen. In CBT, knowing our thinking trap is helpful. Once we know we have a specific unhelpful thinking style, we can then look out for when we're adopting that strategy. We can also challenge our thoughts by asking ourselves, is it true? Challenging our thoughts can help us to look at the situation from multiple angles. Maybe looking at the situation from a different perspective can then help. For example, say that we see someone that we know walking down the street towards us, but the person doesn't say hi. We can then go to a place where we're thinking, oh, they're mad at me. They just saw me and they're ignoring me because they're so angry at me. Well, that could be then mind reading, where we believe that we know what the other person is thinking. It's entirely possible that the person was so wrapped up in what was going on in their lives that they actually didn't even see you. The person was walking towards me and they didn't say hi to me. And here I am thinking it's because they don't like me. But is that true? One last thought about CBT though. For clinicians working with BIPOC people or anyone who's actually experienced racialized trauma, it's important to realize the possible holes in some of our well-worn modalities. CBT is a wonderful modality, but there could be some challenges if a clinician then marginalizes and reduces a person's racialized trauma or some microaggression they experienced as simply an unhelpful way of perceiving the situation. So this is why we want to be really trauma-informed and client-centered, because each person comes with their own story, and we want to be able to hold, acknowledge, validate, and empathize with their entire story, nuances, and all. That's it for CBT. Feel free to hop over to my website for a free download of all of these unhelpful thinking styles that I shared today. Now, as we close out this episode, remember to take a moment in your day to remind yourself to pause, breathe, hope, and heal. Take care. Well, this has been another episode of The Acorn. Remember, the content in these podcast episodes are for educational, informational, and entertainment purposes only. Disclaimer. Anything said in this podcast should not be considered as treatment, professional consultation, advice, clinical instruction or assessment, or any other mental health replacement. Listening to this podcast does not create a therapist-client relationship between you and the podcast host. Always seek the advice of your own mental health provider regarding any questions or concerns you may have about your mental health needs. Also, if you need immediate help, contact your mental health provider or call 911. Take care.